Hello guys, Vanakkam and welcome to Metier International Academy, one of the leading academy in training nurses in the nursing competitive exam as well as IELTS and Flex and OET training. Welcome back to Magic Pill session, and today we are going to discuss very important topic from OG, that is complicated labor. If you like the video, please like it, share it and subscribe the channel so that it will motivate us to post more and more videos. Let's begin the session without wasting the time, and let's begin the session with a motivational quote. The quote is, education is the most powerful weapon which you can use to change the world. Okay, so update your knowledge then and there and clear the exam as early as possible by using the education. Fine. So the first question what we are going to discuss is, pre-term labors occurs between. It is a direct question, and here they are asking the time period for pre-term labor. And they are given four options like 20 to 37 weeks, 32 to 36, 16 to 20, 24 to 34. Like that, four options they have given. Among these, as you all know, it is a simple question. Always we used to go from simple to complex. Here, the right answer is going to be before 37 weeks of gestation. That is called as what? Preterm, right? So here, which is the right answer? So option A, that is 20 to 37 weeks of gestation. That is called as what? Preterm labor. So the answer is option A. Additional golden points are term labor, preterm delivery, post-date delivery. So these three things you're supposed to remember always. See, term delivery means always remember in between 37 weeks and 42 weeks of gestation. In between 37 to 42 weeks of gestation, that in between duration is there. No, that is called as what? Term delivery. The first point. Second one already we discussed, that is premature delivery or preterm delivery, that is before 37 weeks of gestation. If there is a delivery of the baby, that is called as what? Preterm delivery. The next one is post-date delivery, that is post-term delivery after 42 weeks of gestation. That is called as what? Post-date delivery or post-term delivery. Okay, so these are all the three key points you're supposed to remember. The next important question what we are going to discuss is the most sensitive marker to predict the preterm labor is. They are asking the most sensitive marker to predict the preterm labor. Sensitive marker is the key point. Preterm labor is the key point. Okay. So four options they have given here: serum ferritin, Ferning test, cervical length, fibronectin. They are asking the sensitive marker. Okay. So here the right answer is option D. That is fibronectin to detect the preterm labor. See, cervical length, serum ferritin is not at all related. Fibrin test, it is used for means rupture of the membrane, right? Cervical length is not a sensitive marker. So fibronectin option D is the right one. That is fibronectin. The rationale behind this is, let's see the key points or vital points. Fibronectin, it is a glycoprotein, guys. Okay, that is normally found in the cervicovaginal discharge. Okay, so when it will be found in between 22 weeks and 37 weeks of pregnancy, usually this fibronectin will be present in the cervicovaginal discharge. This is the first important point. And second important point is presence of fetal fibronectin in the cervicovaginal discharge between 24 weeks and 34 weeks is the predator. Predator means it is the indicator of the preterm labor. That is before 37 weeks, this especially in the 24th week and 34th week, if this fibronectin is present in the cervicovaginal discharge, means we can confirm that there is a chance for the preterm delivery. So it is considered as what? Sensitive marker for the preterm delivery. Okay. So the next one is additional points. See, not only ferritin test, sorry, we also see ferritin test, it is done only for what? It is acting as a sensitive marker for the preterm delivery. Okay, so this point is over. One more option is there, that is Ferning test. This is very commonly asked question in the exams. Ferning test. See, Ferning test, as I mentioned already, it is used to check for the rupture of the membrane. That is premature rupture of the membrane. We are using the Ferning test to check the premature rupture of the membrane. Actually, two tests we are doing for checking the rupture of the membrane. One is not a specific test, that is nitrazine pepper test is not a specific test. Okay, false positive results are very common in the nitrazine pepper test, so it is not a specific test, whereas Ferning test is a specific test. So what is happening in the nitrazine pepper test? See, actually in nitrazine pepper test we are checking the pH of the vaginal secretion. Okay, fine. So if you are checking the pH of the vaginal secretion with the nitrazine pepper and the nitrazine pepper is turning to blue, it means that the vaginal discharge is mixed with the amniotic fluid. So whenever the amniotic fluid is mixed with the vaginal discharge, means it shows that there is a premature rupture of the membrane. So that is what you are seeing in the nitrazine pepper test. As I mentioned already, it is not a specific test. The next one is Ferning test. Amniotic fluid Here also mixed with the estrogen, there with the vaginal discharge. Here the amniotic fluid, it is mixing with the estrogen and it is creating a fern-like pattern. Just Google and check it out. What is fern-like pattern? So fern-like pattern is present in the microscope, means it shows that there is a rupture of the membrane. It is commonly seen in the ferning test. So ferning test is a specific test to check the premature rupture of the membrane. The next one is premature rupture of the membrane during pregnancy. During pregnancy is explained as, is usually said as spontaneous rupture of the membrane. So when we can say the premature rupture of the membrane as a spontaneous rupture of membrane. This is how you have to understand the question. When we can say premature rupture of the membrane as a spontaneous rupture of the membrane. Beyond 28 weeks, before 28 weeks, beyond 37 weeks, and the last one is beyond 36 weeks. Okay, so here the right answer is option A, that is beyond 28 weeks. We can say the premature rupture of the membrane as a spontaneous rupture of the membrane. Beyond 28 weeks is the right answer. The rationale is premature rupture of the membrane means spontaneous rupture of the membrane. But when? Beyond 28 weeks of pregnancy. See, no, it is not before, it is beyond 28 weeks of pregnancy, but before the onset of labor. After 20, in simple words, after 28 weeks of pregnancy and before the onset of labor. In between these two time period, that if there is a premature rupture of the membrane, that time we can say it as spontaneous rupture of the membrane. The next one, the premature rupture of the membrane, in short, it is called as PROM. Two types of PROM is there. It is based upon 37 weeks of gestation. Before 37 weeks of gestation, if there is a PROM, means that is preterm PROM. You can see here, before 37 weeks of gestation, if there is a premature rupture of the membrane, means we used to say it as preterm. You can see, just see the cursor, preterm PROM. In short, we can also call it as PPROM. PPROM. Okay, fine. So that is called as what? Preterm PROM, before 37 weeks of gestation. But after 37 weeks of gestation means it is called as term PROM. Term PROM. Okay, guys. So this basic difference you're supposed to understand. Okay, even now we are going to discuss one question related to preterm PROM also. Okay, fine. Let's see. So hope you understand this question. The next question is, the nurse working in the labor room understand the PPROM. Just now we discussed PPROM, premature preterm rupture of the membrane can leads to, okay, if there is a premature preterm rupture of membrane, it leads to what? Four options: cord compression, cord prolapse, maternal wound infection, all of the above. So here the right answer is option B, that is cord prolapse. In case there is a preterm pre-labor rupture of membrane, means it leads to what? Cord prolapse. Okay, cord prolapse. Okay, so not only cord prolapse, in rational you can see chorioamnionitis, oligohydramnios, placental abruption, antepartum hemorrhage, maternal neonatal sepsis. These all also can occur if in case of preterm pre-labor rupture of membrane. Okay, guys. The next question is the type of uterine prolapse in which the uterine body descends completely. Underline the word completely. Okay, so that is the key point. Okay, descends completely, lie outside the introitus. Okay, introitus. See, in the vaginal opening, you are completely seeing the uterine body. Uterine body. So, which degree of uterine prolapse is this? This is the question. They are asking the degree of uterine prolapse. So, here the key point in this question is complete descending of the uterine body. So, first degree, second degree, third degree, or fourth degree. So, this is the option they have given here, and here the right answer is what? Option C, that is third degree. See, completely the uterine body is descending means you can say it as what? Third degree. You can see here the location of the prolapse. See, in just below the location of the prolapse, the uterine prolapse word is mentioned. Right here, 3 degrees are there. First degree, the uterine is present inside the vagina. Okay, so second degree, the cervix visible at the introitus. The cervix is visible at the introitus. Third degree, the uterine design outside the introitus. Okay, outside the introitus, either partial or complete. Okay, either partial or complete. Even in some books, you know, they are having 4 degrees of classification. First, second, third, and fourth. In fourth, they used to usually call it as procedentia. That is completely, even the uterine fundus is also coming out. Okay, completely uterine fundus is also coming out. That is called as what? Procedentia. Usually in some books, they are giving this classification as degree 4. Okay, but here, which is the right answer? Third degree, because only the uterine body is descending completely, not the fundus. Body is descending completely. Okay, so that's why we selected what? Option C, that is third degree. Okay, hope everyone understand the questions, whatever we have discussed so far. If you have any doubts anywhere, you can drop your message in the chat box. Once again, I'm repeating, subscribe the channel so that you will be getting continuously more and more magic pill session questions, and also whatever the job alerts is there, we are updating to you. So watch the video, subscribe the channel, and if you like the video, please like it, share it to others also. Thank you very much for watching the video, guys.